How to put ECG leads on a chest. The ECG, electrocardiogram, is used to measure a patient's heart's electrical activity. The test is commonly used to check for many heart conditions, from coronary heart disease to a heart arrhythmia. If you're a medical professional, it's important that you position the leads correctly, since incorrect lead placement can cause improper diagnosis or result in a misreading of the test. Preparing the patient. 1. Ask the patient to recline on their back. ECG tests are always administered with the patient lying flat on their back. Not only does this position make it much easier to find the correct places to situate the ECG leads, but it also keeps the patient's heart beating at its resting rate. If you're in a doctor's office, just have the patient lay back on an examination table. 2. Gain verbal consent to the procedure from the patient. Explain that you're about to place 10 leads on the patient's body to electrically monitor their heartbeat. Clarify that the test will not hurt, but that the leads will need to remain in place for 3 to 5 minutes. Ask the patient to take a few deep breaths and completely relax. 3. Clean the patient's chest before you place your leads. If the patient's skin is dirty or oily, clean it with soap and water and dry with a towel before applying the ECG leads. Dirt and oil can interfere with the electrical readings from the leads. They'll also have a much harder time sticking onto a dirty chest. If a patient has chest hair where the leads need to be placed, you'll need to shave off the hair. Positioning the chest leads. Unpack the ECG leads and read the color coding system. The leads used in an ECG exam are color-coded. There will be a chart on the ECG packaging that lets you know which color corresponds with which lead. The 6 chest leads are medically referred to as the V leads. They're numbered V1 through V6, with V1 being the first lead applied and V6 being the last. 2. Find the angle of Lewis to determine chest electrode placement. Set your fingers at the base of the patient's throat and slide them slowly down until you feel the top of the sternum. Slide your fingers down across the sternum for another 5 to 6 inches, 13 to 15 centimeters, until you reach the sternum's widest part. This is the angle of Lewis. You'll know you've arrived at the angle of Lewis when you feel a bony lump where the 4th rib connects to the patient's sternum. Knowing the location of the angle of Lewis will help you place the ECG electrodes. 3. Place V1 between the patient's ribs on the right side of their sternum. Move your fingers to the right side of the angle of Lewis. As your fingers slide right, you'll feel a gap between the patient's ribs. Slide your fingers down across one more rib until you come to the next gap between the ribs. Place the first lead here. To set the lead, press it firmly into place. The leads are lightly adhesive and will stay in the location you put them. 4. Set V2 across the patient's sternum from V1. Place your hand back on the patient's angle of Lewis and this time slide your hand to the left. Find the gap between the patient's ribs and, as with V1, slide your fingers across one more rib. Set electrode V2 in that gap between ribs as close to the patient's sternum as possible. Setting the extremity leads. 1. Stick lead to the patient's right shoulder below the clavicle. Fix a lead on the patient's arm on the shoulder about 2 inches, 5.1 centimeters, below the patient's clavicle. Press the lead firmly into the patient's skin to fix its position. 2. Press one lead onto the left shoulder below the clavicle. As on the right arm, this lead should be about 2 inches, 5.1 centimeters, below the clavicle. Place the lead at roughly the same location as you place the lead on their right side to ensure that both arm leads give accurate readings. Press down firmly on the lead to fix it in place. 3. Fix a lead on the fleshy spot on the patient's right ankle. You'll have quite a bit of leeway when sticking the leads onto a patient's ankle, especially when compared with sticking them onto the patient's chest. Aim to place the lead just below the patient's ankle bone where there's a fleshy patch. Avoid placing the lead directly over the bony part of the ankle.